Hey guys, it is your Medicare guy Ken here. Interesting development. Amazon RX Pass, which is a $5 a month subscription service for certain generic medications, is now available to Medicare enrollees. This was not always the case. We're going to be talking about what this means for you if you're a Medicare enrollee, and most importantly, how you could potentially save money using RX Pass. So let's dive into it. Amazon's pharmacy unit said on Tuesday it is expanding eligibility for its monthly subscription service, which covers a range of generic drugs, to those enrolled in government-backed Medicare insurance plans. Amazon has worked to lure customers away from more established pharmacies like CVS and Walgreens since launching its pharmacy unit in 2020. So Amazon, we've talked about in other videos, has spent a lot of capital investments in trying to get pharmaceuticals to try to get into this space. And this is a pretty big move on their part. There are other moves. I don't know if they've made as much of a splash as they would have hoped, but this seems to be pretty big. With the expansion, Amazon said over 50 million more people will be eligible to use the service known as RX Pass, which was launched for U.S. Prime members in January 2023 and is priced at $5 a month. So again, this is huge. A lot of people would ask us about RX Pass because they already have Amazon Prime. It was not available to them, but it now is. The subscription gives access to 60 eligible generic medications, 24/7 access to a pharmacist, and free doorstep delivery of treatments for Prime members. Through RX Pass, Amazon Pharmacy offers up to 80% off the cost of generics and up to 40% off the cost of brand name medicines for members with or without insurance. U.S. spending in the Medicare program for people over the age of 65 and the disabled is projected to have grown by 8.4% to over $1 trillion in 2023, according to federal government data. So it's no secret that Medicare is a massive, massive pull for these insurance companies. They are making quite a bit of money from the government. As we can see, $1 trillion in Medicare spending. Looks like Amazon wants to be in on the action. And I think one of the more interesting things to look at is, years ago I read a book called The Four, and it was about Apple, Amazon, Facebook, these big tech companies. And one of the things they talked about is that they basically have monopolies over their particular sector of, technology. So with Amazon, they pretty much have a massive section of the online retail space. And one of the only ways for these companies to continue to grow is to get into sectors like healthcare, like education. So this seems to be one of Amazon's plays to get into the healthcare space to expand their market capitalization. Programs like RX Pass help reduce cost while increasing convenience for caregivers and customers of all ages, which is shown to improve medication adherence and support better health outcomes, said John Love, Vice President of Amazon Pharmacy. RX Pass could help reduce Medicare spending by nearly $2 billion annually and help lower out-of-pocket costs for older adults, Amazon said. Medicare plan members who require one RX Pass medication could save about $70 a year, while those taking two or more could save more, the company said. So this is where things get interesting. I want to dive into what RX Pass is, so you guys have an understanding of what you can actually use it for. And on top of that, we're going to talk about where you can actually save money if you're on Medicare and you have RX Pass. All right, so I'm now on the Amazon Pharmacy website specifically for RX Pass. So 50 plus meds, $5 a month total. So Prime members, you still have to pay Amazon Prime. Then you add an additional $5 a month to that subscription to use RX Pass. So what RX Pass is 60 specific generic drugs. You pay your $5 a month and you can get unlimited amounts of 60 different generic medications. So for instance, lisinopril, finasteride, these are the costs that you would expect, retail, like right here, lisinopril, $20, finasteride, $109. Amazon is saying you can get it for $0. Now, the insurance price that they list here is $2 for lisinopril, $25 for finasteride. I'll be honest, I've seen lower with insurance, even with Part D plans that are comparable to $5 a month, if not less. So it is possible to get these prescriptions for $0 on Medicare as of right now. So I always think when I see these things, cost plus pharmacy is another big offender of this. I think they pump up the retail prices a little bit because, lisinopril does not cost much to make. So, they're saying, $0. Lisinopril is normally $20. With a lot of insurance, it is close to $0, if not $0 already. So, they're trying to say, hey, look at what we do, but it isn't necessarily the savings they might lead you to believe, but that will change when we get to certain prescriptions. So what you do is you subscribe for $5 a day, you add your medications, and they deliver them in the same way anything you buy on Amazon would happen. So it's pretty interesting. I like the 24/7 access to a pharmacist. I really think the big thing to wonder is what prescriptions do they cover, and can you actually save money with RX Pass? So as you can look, we got allopurinol, amlodipine, atorvastatin. This is a generic cholesterol medication. Bupropion, which is Wellbutrin. You know, this is a depression medication. We have escitalopram, estradiol. That can actually be quite expensive at times. Finasteride can be expensive at times. Glipizide, that tends to be pretty low cost. Lisinopril, losartan, these are pretty low cost. Omeprazole, oxybutynin, rosuvastatin, sertraline, sildenafil, that is also known as Viagra. So these are the 60 or so prescriptions. These are all very common medications that a large majority of our clients probably have at least one of these. So I think they know which medications to go for. And the interesting thing here is I don't necessarily think RX Pass is the cheapest for these particular medications. So for instance, if you're just on atorvastatin, you know, there are a lot of plans that have $0 copays for atorvastatin. So it's not like there's some crazy savings to be had. If you already have Amazon Prime, that can be a help to you, that it's all through the same place. You don't have to worry about too much. Where this gets interesting is certain prescriptions are not favored by Medicare and can actually have quite expensive copays. But we would usually recommend GoodRx for these, but this could be lower cost comparatively. So for instance, a lot of people are on bupropion. It is a very popular antidepressant. And what we usually recommend is that you go to GoodRx for this. Now, a lot of people are on Wellbutrin, bupropion, whatever you want to call it. And a lot of people use GoodRx for this because it is not necessarily favored by Medicare. I find the copays can be pretty high considering it is a generic. So for instance, if you were to just get a 1 month supply of 75 milligrams of bupropion, depending on the place you go to, and by the way, this is a deal, it could be $13, it could be $10. So Amazon RX Pass might actually make more sense then. So, you know, if you're on the lowest tier of prescriptions, and I say that, you know, it varies on your plan, it varies a lot. But something like losartan, I don't know if you're going to have a ton of savings with losartan or lisinopril because these prescriptions are very low cost across a lot of different plans. But for instance, Wellbutrin, that could save you some money and some time. I mean, let's, for instance, just look at a 3-month supply of Wellbutrin and see what that says. All right, so, you know, CVS, Wellbutrin, $17 for it. You know, Amazon RX Pass is $5 a month, so it's about the same. I mean, Rite Aid, it's a little bit lower. But where it really happens is, let's say you have 3 prescriptions that you would have to use GoodRx for. You could definitely save some money with Amazon RX Pass. So I think the thing to think about with all this is, I think one of the reasons they can offer these super low prices on these specific medications is there's 2 reasons. One, Amazon is flush with cash, so they're able to do things at a loss for a little bit to gobble up market share. So this seems like maybe a test run to see. The other thing is Amazon RX Pass's formulary is only 60 prescriptions. So they don't have to make up for maybe a loss on a more expensive drug. You know, one of the things that a Medicare Part D plan has is thousands of medications listed, so you have more coverage. So I think this could be a great supplement to Medicare, the same way GoodRx and Cost Plus are a great supplement to Medicare, depending on the prescriptions. But if you're already a Prime member, if you're on a couple of these prescriptions like a bupropion or maybe a finasteride, which can have a relatively high copay on Medicare, this could definitely be a way for you to save some money. I'm not going to knock it. I think it's very situational, but, you know, I'm here for competition. I'm here for people trying to lower drug prices, even if it's a small amount. And, happy to see some innovation in the space. So what do you guys think about Amazon making a bigger push in the Medicare market space? Do you guys already like Amazon Prime? Do you guys like RX Pass? Do you have any experience? Please let us know in the comments, because I'd love to know what your experience with this has been. If you want someone in your corner that is able to look through all these different options, your Medicare Part D plan, your GoodRx, and your Amazon RX Pass, and decide what you are best off with in each situation, definitely reach out to us at NJ Life and Health. Our website is njlifeandhealth.com, or you can call our Toms River, New Jersey office at 848-226-6897. We go through all this stuff with you to make sure you have your lowest possible costs across the board for Medicare based on your specific health needs. So once again, I'm your Medicare guy, Ken. Thank you so much for tuning into this video, and I will see you in the next one.